We also call this rhytidectomy, and that means just removing wrinkles from the skin. Incisions are typically in the hairline and around the ear. So you can see this solid green line. That's what we would expect for the incision for like a mini facelift. Oftentimes we will have a little projection that goes behind the ear, but not this full thing here. And then this full thing here is what describes more of a smash facelift or more of a deep plane facelift. So why do we have a longer incision on these facelifts that are a little bit more invasive? The reason is because we oftentimes get more skin out with these. We actually end up excising more skin following them. And so to do that and to prevent any bunching of the skin or any scarring that we wouldn't want, we actually have to make the incision longer. You'll find that these are hidden. So this is hidden in the hairline here. This is hidden in the crease in front of the ear. This is hidden in the crease behind the ear, and then we hide it in the hairline again. So we can very successfully get these to be not visible at all. Of course, if they were very visible on a lot of patients, we wouldn't be doing it as a cosmetic procedure, and patients wouldn't accept that. So what's the point of a facelift? As our face ages, things tend to fall forward and they tend to fall towards the center. So when we do this, we lift the facial muscles posteriorly, vertically, and towards the sides. And then at the end, we remove any excess skin. So if you look at these other lines here, you'll see that this is a dissection for a mini facelift. So when we get under the skin here, this is about how forward we dissect for a mini facelift. You can see for a SMAS and for a deep plane facelift, we do go further out, and a deep plane facelift actually probably comes out here because we actually do try to disrupt the nasolabial fold here. So you can see you go way further out. Now, what are the pros and cons of that? The mini facelift is great because if we only dissect out to here, it makes for a quick recovery. You don't get a lot of swelling in front of that or anything. And it's a less deep dissection as well. But you can imagine if you're working out here and you're trying to affect changes up here, that can be challenging without putting things under a significant amount of tension. And so when we talk about a SMAS lift or especially a deep plane lift, we talk about freeing up all these tissues, freeing up the ligaments so that there's no tension. And then when we redistribute the skin and the soft tissues, we can get a really nice effect without having any pull. All right, so let's get into kind of the meat of what these facelifts are and what the differences are. So the mini lift, you'll see a lot of different ways to describe this. People call it the weekend lift, a short scar facelift, the S lift. There's been so many different iterations of it. They're all about the same. So as I said, you get less powerful lifting of the neck and especially really no change in the midface here. It's typical for patients to say that they look about 5 years younger. Again, this is useful in younger patients who are just beginning their kind of progress with facial aging, and patients who have changes in the lower face here. Typical recovery is about 1 week off of work or downtime, and 92% of patients will say it's worth it. So more specifically, if you take a look and you separate this patient's lower face from their upper face, the lower face, we do get a robust result. And I'll admit for a mini facelift, this is a very good result. Oftentimes to get this much of a result in the neck, we will have to do a more invasive facelift. But you see, this is really, it does help with the jowl. It helps with the pre-jowl sulcus. It helps to, alleviate this loose and hanging skin here and gives her a better jawline. But if you look at the midface here, there's really no change. The nasolabial fold, the marionette line is pretty unchanged from pre to post-op. Of course, no change in the eye, but you see that where the cheek has fallen down, there's really no change there either. Now, if we move to a little bit more invasive facelifts, we talk about a SMAS lift. So extended SMAS and SMAS lifts are some of the more common facelifts performed by general plastic surgeons, but also by facial plastic surgeons. There is a longer incision, and there is improved lifting of the neck. You do get a little bit of volumizing in the cheek, but not a lot. You'll see that, remember the mini facelift, we really only dissected to about here. So in a SMAS facelift, we dissect more forward, and then we do make an incision into the muscle layer of the face. So you are getting a little bit of pull on the muscle layer of the face, which is exactly what we want to lift this. The recovery is a little bit more, so about a week. Some people take 10 days. Usually you get sutures out at a week. And then we actually have data on how patients do afterwards and how they feel about their facelift. And patients on average feel about 6 years younger, that they look about 6 years younger. And you'll see this is a little bit lower actually as far as the worth it rating. I think the mini lift was 92%. We're down to about 86%. This one, I would say, at least for myself, is offered less often. Oftentimes I will offer patients a mini lift if I think they will do well with that. And then I jump straight to a deep plane facelift if I think they need more lift. And you'll see why in a moment. So moving on to the deep plane facelift. It's the same incisions as this mass lift. So when we talk about a deep plane facelift, we undermine the skin here. And then at this green line here, this is where we jump into what we call the deep plane. So the deep plane is where we get under some of the facial musculature, and that way we're able to free up the ligaments that really hold everything in place here. So that's this ligament here, it's a ligament here, and there's one over the bone here. So when we free those up, you see that you require a lot less tension in order to get the lift that we're looking for. The control of the jawline and neck from a surgical standpoint is unparalleled with the deep plane facelift. It is the only facelift that can adequately lift the cheek or the mid-face meaning this area here. Additionally, it's the only one, like I said, that can really efface the nasolabial fold here or the marionette line here. I will admit it's more technically demanding for surgeons, so you want a surgeon who's comfortable with deep plane facelifting, who's been trained in it, and who's done a lot of them. And so you'll want to find a surgeon who feels comfortable going into this. And patients who get this done, as you can see, last I talked with the SMAS facelift was about 6 years younger. We have data to say these patients feel about 8.9 years younger. And so we typically will tell patients, with a non-deep plane facelift, expect to feel 5 years younger, and with a deep plane facelift, up to 10 years younger. And you can see this is why I tend to jump straight from the mini lift to the deep plane facelift if a patient needs it, because the vast majority of these patients, we're talking 98% of these patients, say it was worth the cost, worth the downtime, worth the recovery, worth everything in order to get this done. Here's just a couple examples from our group from the deep plane facelift. You see this patient had a very heavy neck. She did have some fine wrinkles in the midface here. She had a lot of loss of volume in the midface here. And post-operatively, her jawline is greatly improved. You can see this volumization here of the cheek. She looks great. And then same here, I like this photo because you can see she had a pretty significant pre-jowl sulcus here, pretty significant jowling, and she had some loss of volume in the midface, but nothing crazy. And you can see her jowling and her jawline is just greatly improved. You can see the wrinkling of the neck greatly improved, and we got rid of these platysmal bands here. She additionally had some submandibular gland fullness here, which we were able to kind of sling up with a facelift without having to remove the submandibular glands.